Our Talk to Doc series continues today with what to ask your doctor in your senior years, talking about your 60s, your 70s, covered the teens, the 20s, the 30s, the 40s, and the 50s. Now, health specialist Leah Sarich says it is time to think about maintaining, maybe even improving the quality of life that you have left to live.
Exactly. So this is what we're really going to talk a lot about today, which is the quality of life, not just extending it, but making sure you're living well in these final years. And you know, in your 60s and 70s, you may actually have more time to do that because maybe you're retiring now. Maybe your children are adults and they're busy with their own young families. So you might have a bit more time on your hands to actually look after yourself. So Dr. Raj Bardwaj says now is the time to think about that quality of life. So he says it's really important not to just write off any symptoms as, oh, well, I'm just getting older, it's just aging. Really take those symptoms to your doctor and look at it. Say, no, this isn't just aging.
If it's concerning you, if it's changing your life, if it's getting you up at night to go pee 3 times or something like that, maybe that's not just aging. Maybe that's something that you want to approach your doctor about and say, you know, is this normal for me with my past history, my family history, my medications, my specific profile? Right? Because talking to your friend at the hair salon or whatever, or at the mall, and they say, wow, that happens to me, it's just aging. It's like, okay, it might be for you, but that's not necessarily my same trajectory.
And then the good news is, right, exactly, that trajectory can be changed. So even if you, say for example, your dad has a heart attack, right, in his 70s or 80s, well, so that increases your risk. But maybe you both smoked, but maybe now if you bring this up with your family doctor, they can do other things to change your trajectory, even though you have a similar lifestyle. They can lower your cholesterol, right? They can make you do some lifestyle changes. So they can do something about this. The other thing to think about in this age group is that, yes, your body is changing. So of course, your skin is going to change, muscles are going to be a little bit weaker, and that's going to bring up some of those kind of annoying sort of little symptoms, things like heartburn or maybe incontinence, which can maybe not be so little and can certainly affect your quality of life. But really what Dr. Raj always says is you just have to tell your family doctor about it, because if you tell them, then they can help you. Something also really important to think about at this time is that idea of heart attack and stroke, because that's when these things start to occur in this age group, and these things require immediate treatment.
Strokes and heart attacks are both, the treatment for those are very time critical. So if you were having wicked chest pain and you thought maybe this is a heart attack, 911 is the right answer, right? Same thing for a stroke. Strokes don't cause a lot of pain, but you should know what the signs of stroke are, so that if that happens to you or to somebody that you know or a loved one or whatever, that you can call 911 and get to the hospital as soon as possible, because there's a critical time window where we can do a lot to treat and reverse the damage of a stroke. But if we miss that time window, then we're just watching the stroke happen.
Right, and we don't want to do that, absolutely not. So again, bring this up with your doctor. Say, okay, I'm in my 60s and 70s now. What are those symptoms of the stroke? So I know what I'm looking for, either in myself or in my partner. Something to keep in mind.
Something also to keep in mind, dementia, early signs.
Of course, yes. So I just covered this on the show a couple of weeks ago, but yes, dementia, of course, is something to think about in this age group. That's the most common time for these symptoms to set in. So again, talk to your doctor about any of those simple symptoms or the early warning signs, because there are medications and things that they can do to slow the progression of some of these cognitive decline sort of things that are going on. It's also really important to stay engaged at this stage of life. Dr. Raj says one thing to really think about is hearing loss, right? So if you can't hear what's going on around you, it's very easy to sort of remove yourself from social situations and isolate yourself, right? And again, with vision as well, vision loss. If you're not seeing things, it's harder to stay engaged. So he says really look at hearing loss and get your eyes checked and really avoid that social isolation. One thing that Dr. Raj really recommends is that if you can, get out there and exercise and do it with a friend, because then you're sort of killing 2 birds with 1 stone. So not only are you exercising, which we know research shows that will keep you younger, but you're socializing with your friend while you're doing it, whether your partner or your friend. That is a really important thing to do, for sure.
Right.
Yeah.
Now, I think exercise ties into this, and something that we as women, I think, hear a lot about throughout our lives, osteoporosis.
Osteoporosis is something to think about in this age group, but not just for women, for men too, and we forget about that. So women and men need to talk to their doctor about osteoporosis, and the thing to know here is to get tested before you fall, before you fracture your wrist, or before you break a hip, because it's again about maintaining that quality of life. So yes, you may recover from that really big injury, but you may not have the same quality of life. So that's definitely what to keep in mind.
Okay, wrapping up the series
Yes.
tomorrow, Leah.
Okay, so now we're talking about end-of-life decisions, how to negotiate those conversations among partners and making sure that those wishes are carried out.
Fantastic series. More information on her blog as always.
Yes,
Health Specialist
always.
Leah Sarich. Thank you for that.
You're welcome.
We're going to check it.